Hey, good morning, good morning. Well, at least it's good morning here on the East Coast. I just wanted to come on real quick. First of all, I want to say that I appreciate all of the medical staff, nurses, doctors, CNA'S, every form of medical practitioner that's out there that's really sacrificing their lives to help people, patients, people who are sick, all kinds of sickness, and especially the COVID-19. And I just thank God for all of them, just sacrificing even their time, not in their life, their time away from their families and everything. And I'm just my heart goes out to them and my prayer goes to them. But today, because I'm a mental health professional, I really wanted to acknowledge the mental health workers like us who are sometimes out here in the field still meeting with our clients when necessary. We have to deal with the mind, set in the state of mind that they may be in, whether that's anxiety, an increased level of depression. We still have to help them cope with all of this. And it's been really hard for some of my clients who are losing like a lot of people that they can't even get to and touch right now. And so one thing about like other medical professionals, mental health professionals, most of the time we are on 24/7 crisis call. So our phone can ring all during the night, in the morning. We're supposed to be available to take calls and just be on all the time. And this is one of the reasons why I made the self-care workshop, because of that, learning how to cope and take care of ourselves, because we constantly get, receive so much messages and people dump. It's a safe place, which is a blessing, that people feel free and able to dump a lot of their trauma and what they're experiencing and what they're feeling on us. And so it's important that we take care of ourselves, that we do the deep breathing, that we do all the things that we tell our clients to do so we can stay on point, because it's almost like we always have to be ready to perform. We have to be ready to give an ear. We have to be ready to listen. And so we have to take care of our own nervous system. We have to practice staying emotional regulated ourselves, because we don't know what news we're going to hear. We have to set our nervous system so we can be able to deal with stuff, to hear information, protecting our ear gates and our eye gates. And so it's a lot now. It's even more increased now, that we just have to be, ready, willing, and able. And, I say my prayer all the time when I have to go out, because sometimes our clients, if they don't have transportation, they can't get to places, even the people that do support them. We practicing physical distancing right now, or you want to call it social distancing. They can't get to them to help them. So when things get really, really tight, we go out and help our clients. If sometimes that looks like helping them go to the store and get the food that they need, or taking them to shelters or to places to get financial assistance. Whatever that is, sometimes it's us that's out there taking them in the streets, wherever they need to go, because they're in a crisis. And we're in a crisis as well. So we're all facing this whole crisis together. So I just really wanted to acknowledge the mental health workers who we feel like, we always have to be on emotionally, and that's not realistic. You know what I'm saying? So we have to really be intentional about taking care of ourselves, where our mind, knowing where we are, what we're feeling. So part of that is the spiritual care, praying and preparing our spirits to prepare to receive any kind of traumatic news. When we have our own traumatic stories. I remember not a couple of weeks ago, and even recently, I lost another family member, and I lost a few family members, and then I'm speaking to clients who lost their family members. And so we're like all in this thing together. But can you imagine having to just be, able to listen and allow people to vent when you feel like sometimes, or we feel like sometimes, we don't have that chance or that safe place where we can vent. Thank God for those of us who have supervisors and directors and those type of empathetic leadership that we can go to. But sometimes you like to, go to other people as well and share what we're going through, the load. Sometimes we don't even think about it, because we are always in the mode of first response, crisis mode, crisis stabilization. So we're trying to stabilize our clients while we're trying to stabilize ourselves. And the same thing with medical professionals. They're doing the same thing. You helping people coming in trauma unit and helping them in the hospitals and all these emergency places, rooms. And it's like you don't even have time to process what's actually happening. So that's why we have to pay attention to what's going on inside of our mental state, because sometimes at the end of the day, when you're finished, this is when stuff can hit you hard, you know, and you'll be able to reflect and just, so that's the time to acknowledge, how are you dealing with this? How are you coping with this? Especially mental health professionals out there. How are you dealing with this? How are you processing everything that's going on? It's important to acknowledge what you're experiencing, not letting it consume you, but it's helpful to acknowledge it. It's unhelpful and unhealthy to deny it, because then that's just repressing your feelings, your emotions, and the trauma. So it's good to acknowledge it. And I hope you have somebody you can share with. You know, I thank God I do have a few friends, and I have friends that's also in the mental health and the human services field, where we can kind of share some of our experiences and what's been going on. You know, because we need an outlet. We need to have our own catharsis. We need a cathartical moment, you know, to be able to express, get it out, process it all. And then, you know, when we do that, get back into a calm state and be ready for the next season or the next session. You know, so I just wanted to put this out there and acknowledge everybody who are first responders, everybody who are kind of on the front line, or always, you know, helping people going through this crisis, that we're constantly out there helping people. So that's my little thing for today. You be safe, you be careful, God be with you. Talk with you soon. Bye-bye.